Welcome to Clydeouts Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Mona Bonanno, the Medical Director of Pediatrics at Millard Fillmore Suburban Hospital. We'll be discussing newborn delivery and the important topic of rooming in. I'm Mike Hughes, and this is Medically Speaking. Bonanno, thanks for joining us today.
Thank you for the opportunity.
So rooming in has been a topic of conversation for a long time in pediatrics as well as newborn care. Can you first tell us a little bit about what that means and what that topic and how you bring that topic into the conversation for maybe parents who are expecting for the first time?
Sure. What rooming in means is that moms and babies, parents and babies, spend 24 hours a day in the same hospital room throughout the hospital stay. It's part of a newborn initiative that's supported by the World Health Organization, the Centers for Disease Control, the American Academy of Pediatrics, and the New York State Department of Health, among many other organizations.
Sure. So the industry is trying to make sure that parents understand by utilizing their physicians that the importance of the babies in the room at the same time, whether or not mom's sleeping or the baby's sleeping, but just to make sure that that bonding occurs sooner.
That's exactly right. And I think something that's very important to keep in mind after babies are born is that they're born very vulnerable. They're born into an environment that is so different from the one in which they developed. Sure. And immediately after delivery, they rely wholly on their parents for the sense of safety and to be able to feed, sure. Which are the two basic necessities of human survival, food and shelter.
Right.
Sometimes I use analogies to help parents understand what this might feel like.
Right.
So I'll often say to parents, imagine if you were suddenly plucked off the face of the earth, the environment in which you're most comfortable and which you know how to navigate, and tossed onto, without much warning, a different planet. Sure. One that is completely unfamiliar and scary because you have no idea how to navigate it.
Right.
Would you want to be there all by yourself trying to figure out how to survive, or would you want to be there with someone you know and trust who says, I've done this, I'll help you through it?
Right.
And I think most people would choose the latter scenario, and it's not too much of a stretch to understand that our babies feel the same way.
Right.
And babies are born with survival instincts and survival reflexes that allow them to survive no matter what kind of environment they're born into. I think we sometimes forget that not every baby is born in a modern hospital in a modern country.
Sure.
Babies are born in all kinds of different environments all over the world,
right.
But they universally possess these reflexes and instincts. And some of those reflexes include the hand grasp, the toe grasp reflex, and the Moro reflex, all of which are meant to allow the baby to cling to its mom after delivery. Mm. And they have a suck reflex in an effort to feed. So the mom essentially becomes the baby's shelter, and the baby has a suck reflex in an effort to feed. So if we allow babies to remain with their moms, with their parents after delivery, again, they have that sense of safety. Staying with their parents is where they expect to be after delivery. They feel protected, they feel cared for, and I think most importantly, they feel cared about.
Right.
And we see that reflected in more stable vital signs, less crying, and less utilization of their blood sugar, so they lose less weight after delivery.
So is there so much focus on the delivery itself and getting through that process that, moms and, obviously dads or, the fathers, they're part of that conversation as well. Do they lose focus or do they lose sight of the immediately in the 24 or 48 hours after the delivery and the important part of that bonding because they're so focused on delivery and that's why the rooming in conversation has to happen?
That may be part of it. And I think for a lot of parents, their expectations of what the baby might behave like after delivery aren't necessarily all that realistic because they're affected by what's seen in the media, what they might be told by their peers, their friends. And I think if we try to allow parents to understand what the baby's going through from the baby's perspective, it helps them to have more realistic expectations. And when babies are allowed to stay with moms and dads after delivery, it really forges a very strong parental bond. One whereby mom understands that the baby needs her. We know that babies can recognize their mom's voice in the 3rd trimester of pregnancy. And so some of the most immediate understandings or relationships they make are with their mom and dad right after delivery, and they begin to associate what their moms look like with what their moms sound like, what they smell like, and they can identify and differentiate mom and dad from other people right after delivery. So when moms and babies are able to spend time together in their room after baby's born, moms really develop a strong sense of purpose. This baby needs me. Right. And so not only does the baby belong to the mom, but mom belongs to her baby.
Right. So what if, mom will say, geez, I'm tired, can't I get some sleep? And, isn't that what the nursery's for? Do you have to have those conversations and say, we understand, but it's okay that, you both sleep in the same room at the same time, and nursery is, yes, the nursery is right down the hall, but it is important to have them in the same room at the same time.
Correct. Assuming mom and baby are both medically stable, moms actually sleep better when babies stay in the room with them, because research shows they aren't concerned about where the baby is, what's taking so long for the baby to come back. And not only that, but parents have a much better understanding of how to care for their baby if they remain with their baby day and night in the hospital. Nurses are certainly there to help out. Physicians are certainly there to help out should they have questions, concerns. But parents are much more in tune with their baby's cues. They understand their baby's behavior better, and they're better able to address their baby's needs if they remain together in the hospital, such that they feel a greater sense of confidence and capability when it comes to taking the baby home.
What about the newborns? You talked about their care, but what about their testing? How important is it that they're in the same room for things like that?
That's really important too, because when testing can occur at the bedside, then parents can help soothe the baby during the testing and immediately afterward to minimize the baby's stress level. I think all of us would have a hard time imagining, say, a 1-year-old child being removed from the room where his or her parents are to have a blood test done or a vaccination given. Right. And again, we shouldn't really treat our newborns any differently. They would undergo the same level of stress.
Sure. So having a baby is an exciting time. There's an awful lot of information, the parents will have to get through. What are some of the things that you encourage parents to really think about as they're coming into the hospital, as they're getting ready to go through that process?
I would strongly recommend prenatal classes, because much of this information will be revisited during class. I'd also strongly recommend a breastfeeding class for moms who are interested in breastfeeding or just want to find out more about breastfeeding. Certainly rooming in and skin-to-skin contact can establish more successful breastfeeding in the hospital.
Sure.
Parents can go to kaleidahealth.org and click on the Millard Fillmore Suburban Hospital link, where they'll find more information under the Women's Services tab.
That's great. Well, Dr. Bonanno, thanks for joining us today.
I'm very happy to be here.
Thank you. I'm Mike Hughes. We'll see you next time on Medically Speaking.